Hello and welcome to a brand new episode of Health 360. On the show this week, we will be telling you about the findings of the Indian Council of Medical Research that indicate that 62% of the calories consumed by Indians is coming from poor quality carbs. And that obviously is the reason why our diabetes and obesity levels are shooting up like never before. What's with this obsession? Also on the show, the magic of the soleus muscle and how that muscle on your calf can help you control your post-meal blood sugar spike. Lot more news around the world of health, wellness and fitness up ahead on the show. I'm Sneha Mordani. Let's begin with the headlines. Within 6 months of its launch, Eli Lilly's diabetes and weight loss drug Mounjaro has become India's second highest selling medicine, clocking 80 crore in sales in September alone. The once-a-week injectable has surged amid India's growing obesity and diabetes challenge, overtaking leading brands like Panty. 22 children in Madhya Pradesh have died after consuming contaminated cough syrup in India. The errant pharmaceutical company Sri Sun Pharma has been sealed and closed down. The owner on the run has now been arrested. The World Health Organization has expressed concern over a regulatory gap in India's screening of locally sold syrup medicines following the deaths of 22 children linked to toxic diethylene glycol in cough syrups. The WHO emphasized the need for improved domestic regulation to prevent such incidents. CDSCO, India's Central Drug Regulatory Authority, has said none of these products are exported to other countries. An RTI file by India Today has exposed alarming gaps in Delhi's public healthcare infrastructure. Nearly 1 in 3 ventilators across top hospitals, including Maulana Azad Medical College and Lok Nayak Hospital in the national capital, are non-functional. Once vital during the COVID crisis, these life-saving devices now lie defunct, raising serious questions about maintenance and accountability. Delhi Health Minister Pankaj Singh has responded, promising urgent action to fix the lapses. The 2025 Nobel in Medicine honors discoveries proving the immune system isn't just reactive, it self-regulates like a thermostat. Japanese scientist Shimon Sakaguchi found regulatory T cells that prevent the body from attacking itself. Americans Alexander Rudensky and Fiona Parry decoded how these cells control immune balance. The breakthrough reshapes treatment approaches for autoimmunity, allergies, and cancer. They truly are the serial killers, and why wouldn't we call them that? Well, at the end of the day, that's what's really driving the diabetes and the obesity epidemic in India. A research by the Indian Council of Medical Research indicates towards the direction that 62% of our calories of all Indians is coming in from poor quality carbs. And that's the reason why we're red flagging overconsumption of rotis, rice and other kinds of carbohydrates, which actually make up maximum part of the quintessential Indian thali. We decided to explore how you can fix that in your breakfast, your lunch, your dinner and your evening snacks. Here's more. India is the diabetes capital of the world. That really is no secret. We have the maximum number of diabetic patients in the world. We are quickly on the way to become the obesity capital of the world as well. Obesity levels have doubled in India in the last 1 decade. Metabolic diseases are increasing, and that's a big problem there. That's perhaps the reason why the government body called the Indian Council of Medical Research decided to undertake a survey on what really is going wrong. Now, this survey done by the Indian Council of Medical Research has found one basic thing. The Indians are getting their nutrients, essentially their carbohydrates, and that forms a majority part of the diet. So we are going to give you an idea about what a good breakfast, a good lunch and a good dinner looks like, and also tell you on where you are going wrong in your carb intake. Well, be truthful to yourself. How many times have you thought that this is actually a healthy breakfast? This is a masala dosa. Let me just pick it up for a better view for our viewers. And of course, it's got sambar, it's got chutney, and it's a masala dosa with a particular, the usual potato filling in it. And these are idlis. You know, I've heard this so many times from a lot of people that, you know, a South Indian breakfast, yes, it's a very tasty breakfast, but it is not really a light breakfast in the sense of the word that it is very, very heavy in carbs. So this becomes absolutely problematic. Then comes a typical North Indian breakfast, chole and a batura. Now think about the deep fried batura and the chole, which is literally dripping in oil. That's how we prepare it, don't we? Bread and jam or bread and butter, especially because the quality of bread in our country is questionable. It is brown bread, but I'm very sure this is purely caramelized and nothing else. So bread jam isn't a good breakfast option. Muesli again, or cornflakes or chocos. You know, these are products that are quickly given to children because they tend to finish it up quickly in the morning when you have a school bus to catch. But trust me, it's the worst thing to put in the body. So let's tell you a little about good breakfast options. Well, if you're a non-vegetarian, nothing better than this. Well, this is a boiled egg, but you can use it in different forms. For example, a scramble is good enough. Little bit of an oil or even ghee or butter. That's where you can use. Mark my words, if you're having a paratha or a dosha, you'll probably be hungry by noon, but not when you're having an egg. Well, vegetarians have got nothing really to worry about. If there's paneer, if there's tofu, you can do a quick rajma chaat, which is basically rajma boiled, you know, with some chopped onions and tomatoes. Put in that and it's stirred together. That's a great breakfast if you are a vegetarian. Greek yogurt. Essentially, this is high in protein, more protein than regular dahi. A Greek yogurt with some nuts is a great breakfast option. Let's talk a little about what we are having in the afternoons. Our lunch, typically an Indian lunch would be dal, chawal, sabzi, healthy, doesn't it? Nothing fried in it. What's really wrong with it? But the big question, it's loaded with carbs. So if I have a methi pulao today, which I do for lunch, I also have potato. So this is also a very carb heavy meal. What you could do is that throw in an omelette, reduce the quantity of the rice, add some salads and foods which are carb heavy. Essentially, what I typically do is fill myself up with proteins, for example. So if you're having a pulao, throw in an omelette, reduce the quantity of the rice, have the dal, have the sabzi. If you're thinking that your regular dal and your chawal and your sabzi is giving you protein, it's a mistake that you're making. It's giving you more and more carbs. The other thing that vegetarians can do, a lot of people say, you know, we don't like paneer or we are vegan. Soya chunks. A soya chunk sabzi like this, minimal oil is great and goes with your roti as well. So fill yourself up with this. For lunch, another popular thing to do is grab your favorite rajma and chawal. In that case, when you're really craving for rajma chawal, what you can do is reduce the quantity of your chawal to very minimum and fill yourself up with rajma. A lot of people even like consuming just rajma like a curry, but not have any sort of a side with it. For example, not have any roti or not have any rice. That's a great way of moving forward. Now for dinner. We tend to kind of repeat what we're having for dinner. It's similar to what we've had for lunch. For example, if you're having dal, sabzi, chawal for lunch, we usually will have some sort of a sabzi or roti with maybe raita for dinner. What you can actually do is that you can, with the same ingredients, work towards getting enough protein heavy meal and a meal which is low in carbs, because most of us actually end up going to bed right after our dinner. What you can actually do is that avoid your rotis for the night, avoid your rice for the night. Grilled foods are great and they aren't really fancy. You can grill a chicken, you can grill any kind of lean meat that you like. So the other thing is that a lot of people think that they're not having excessive salt or excessive sugar. Many people say, "Maine to mithai nahi khai, so where is my sugar?" The fact is that salt and sugar are hidden in many food products. The condiments, for example, your pickle has got a lot of salt. Reduce the intake of this. Also, your papad has got fair amount of salt. That is something that you should be mindful about. So to sum it up, the Indian thali, in my opinion and in the opinion of many doctors, nutritionists, dietitians, is actually very healthy. The problem is with the timing of what we eat and the proportion. Remember that it always is a game of portions, and that is something that you must be mindful about. All right, let's get in a word from Madhavi Shilpi, a diabetic coach and also a nutritionist. Thank you so much for speaking with us. You know, I want to ask you, the traditional Indian thali is actually very healthy, isn't it? But the problem isn't the portion. The problem is that it is carb heavy. Once that is settled, it isn't that bad, isn't it, doctor?
The traditional Indian thali is beautifully diverse and deeply nourishing. It's brought together grains, legumes, vegetables, the chutneys, papads, pickles, dahi, and then sometimes paneer, fish, chicken, eggs. In the times when this thali was eaten and it was carb heavy with the rotis and the rice and the bhakris, people used to be more physically active. People walked everywhere, did a lot of manual labor, perhaps in farms or in their homes. But in today's times where we are much more sedentary, much more stressed out, meal times are not divided correctly, this thali is proving to be very imbalanced. What we're looking at is reducing the portion of carbohydrates, that's the roti and the rice that form the part of this thali, and replacing some of that with better quality proteins.
How important is portion control in managing metabolic lifestyle disorders?
So it's only when food choices are being done correctly does portion control come into play. It's not possible to have smaller portions of burgers and ice cream and Coke and still be healthy. So choose better food and then go down to portion control. Even healthy food, when overeaten, can tip over calorie balance and then continue to add to problems like belly fat and insulin resistance. So being mindful of what is going on your plate is important.
Also, there is a perception that, vegetarians don't have too many sources of protein in their diet. Tell us, isn't that really a myth? There's a lot of protein sources for vegetarians as well in breakfast, lunch, and if at all, it has to be 3 meals.
Most breakfasts eaten across India are usually carb heavy. There's poha, there's upma, there's idli, there's dosa, there's toast, but they can be balanced out by adding protein to them. So good protein-rich breakfast options for vegetarians in particular could be doing a paneer bhurji on the toast instead of jam on toast. The paneer could also be tofu if you don't want to eat dairy. Millet or legume-based chillas and dosas are great as well. So a moong dal chilla filled with a little bit of grated paneer, chutney and dahi would be wonderful. If all else fails, even a protein smoothie made with nut butters, seeds would be an excellent choice.
I'm going to thank you for joining in and sharing your views with us right here on Health 360. Very often you don't have time to go in for that walk after a meal, which of course is ideal. What do you do then? You immediately have to come back and sit perhaps for your work or while in office. Well, simple calf raises while on a seated position, exercising your soleus muscles is going to help you in a great way to control your post-meal sugar spike. And that is something that's going to help people in general and also, of course, people who are suffering from diabetes. This study is peer-reviewed. We aren't really saying it. It's backed by solid science. Here's the magic of the soleus muscle push-up. What if I told you that while seated like this, you can use your calf muscles, and that actually is a very good way to beat your blood sugar spike after a carb heavy meal? Sounds unbelievable? Trust me on that. The Solace push-up, done exactly like this by raising your calf muscles while you are seated, exactly in rhythm, like the way I'm doing. This is actually the simplest exercise. All you have to do is push up your calves up and down exactly like this. This is actually a low effort activity which you can do even while sitting after your meals, while in office, even while watching TV. This really doesn't require much of an effort, but it requires rhythm. Raising your heels in this fashion actually activates your calf muscles. Now, we often do this while exercising at the gym as well. But right here, the good thing is that you don't really require to be in a gym setup. You can be seated, it can be discreet, and it can be done very, very silently. For those who are pre-diabetic or already have elevated sugar levels, this is an excellent exercise. So what really is the science behind it? Well, your calves contain a soleus muscle. It does the job of soaking up extra glucose. The study that supports this is published in the National Library of Medicine. A simple seated calf raise can boost local oxidative metabolism. The study's participants showed glucose reduction of up to 52% in some cases. The study introduced the term Solace push-up. Well, unlike other muscles that get fatigued very quickly, the soleus muscle isn't really wired like that. It's actually wired to work efficiently for hours together. The study showed this movement increases glucose uptake without relying on glycogen stores, making it ideal for managing post-meal sugar spikes. Think of this as a biological trick that works silently while you sit. But this really isn't your replacement for regular exercise or healthy eating. There is no escaping that. Hello and welcome to this special segment of Health 360. Well, last week the world observed the World Health Day, reminding us of how crucial heart health is in our daily lives. And today we are joined by a very special guest, Dr. V.K. Jain, fondly known as the CPR Doctor of India. Well, Dr. Jain has trained over 2 lakh citizens in CPR, campaigned tirelessly for mandatory CPR education in schools, and has taken his mission far beyond hospital, working on environmental sustainability, solar energy, rainwater harvesting, and community hygiene initiatives across Rajasthan. He was recently awarded a state-level honor by the Chief Minister of Rajasthan for his outstanding contributions to public health and environmental awareness. Dr. Jain, thank you so much for your time. I want to begin by asking you about your mission around CPR training, which has touched over 2 lakh lives. What really made you start this movement, and how serious really is the awareness gap when it comes to CPR and emergency cardiac care in India?
During 45 years of my clinical practice, I saved thousands of lives. But unfortunately, many lives could not be saved because the person standing nearby, the relative or friend, was not aware about CPR, and that patient could not be survived because he didn't get the first responder response initially. So that led me to think that all Indian citizens should be trained in CPR. To achieve that mission, I sold my hospital and I have dedicated my whole life to get CPR training included in the school curriculum, so that all the citizens can be trained in some years, as it is being done in developed countries. The gap in Indian or foreign CPR rate, the bystander CPR rate in India is less than 2%. It is dangerously low. While in developed countries, 50 to 70% people are CPR trained. So most of the patient victims which have sudden cardiac arrest, they get CPR till the ambulance arrives to the hospital. Services are available. So this is very dismal condition, and once all the citizens are trained, then no patient will die without CPR. The other gap is The ambulance response time is very low, very high, very inconsistent. It is very unpredictable and taking lot of time. And CPR awareness in the society is very poor. So this gap has to be fulfilled. The question of cardiac emergency services, it is very good in hospital settings, but before hospital setting, it is very poor stage.
Doctor, you've strongly advocated for CPR training to be made mandatory in schools. Why do you believe this is critical? And how do you see transforming public health at the grassroots really?
School children are like kora kagaz, kacha ghada, fresh clay, blank paper. They can be taught easily, they learn easily, and they retain the knowledge till life end. And they carry this message to the family, society. Teaching in school is very easy, cost effective, doesn't need more manpower or money or material. And it is being practiced in most of the developed countries. But we are seeing that in developed countries, this much CPR awareness is all because of there is mandatory in school curriculum, in secondary school syllabus. And if in India it is introduced, then 2 to 2.5 crore students get admission in 10th class. Means about 2.5 crore of students pass every year. And if they are all CPR trained, then by 2047, when we are expecting Viksit Bharat, at that time more than 50 to 60 crore of public will be CPR trained. That means every household will have 1 or 2 CPR trained person. And my mission will be birth if even one child saves his parent, father or relative or friend.
You've also worked tirelessly on solar power, tree plantations, water conservation. What connects heart health and CPR with environmental sustainability in your vision for a healthier India, sir?
As all of we doctors say, throughout my life I have practiced and treated my patient with medicines. But in MBBS we have one big full subject of PSM, preventive and social medicine, that teaches us not only medicine and surgery but prevention, how to prevent by social methods, what social changes we can do. And it was taught that prevention is better than cure. The prevention is more important. So the most important thing is environment. If it is pure, it is not polluted, if it is clean. So I have installed solar panels for clean energy, green energy, rainwater harvesting for pure water and water recharging, then plantation, even more than 1,000 people in one place. And I filed PIL in Rajasthan High Court for door-to-door collection of garbage across the Rajasthan state, and since 2016 it is being practiced in Rajasthan because of my PIL. Secondly, I have established food safety laboratory, and I am motivating for landless kitchen garden. So my aim is, if persons are getting unpolluted things, then it will be heart friendly, health friendly. So in one way I can say that this is my CPR of society, CPR of environment.
Well, after this year's World Heart Day, what is the message that you want to give to ordinary citizens, those people in smaller towns, rural India, when it comes to prevention, early action and community readiness, sir?
Too much saddening, disheartening that especially after COVID, the heart attacks and cardiac arrest incidence has drastically increased. This is all because of one reason is lifestyle changes. There are many things one can do about lifestyle change. One is avoid fast food. Fast food means it kills you fast. Then there are fast delivery apps are there. No doubt they deliver you food very fast, but they deliver you to Yamraj also very fast. They cannot give the food which our Nani, Dadi used to cook and prepare. If we follow those principles, then there will be no problem. Then I will request all of the audience that avoid stress, do moderate exercise, and take good sleep. Good sleep is very important. Sleep prevents most of the diseases, treats the diseases, and sleep improves all health parameters. My main mission, which is CPR in schools, so I request everyone, please get trained in CPR, teach others CPR. I request you all to request to the government, to NCRT, to secondary school board, state and central boards to include CPR training in school curriculum, secondary school curriculum. In the end, I can say, जो करे अपनों से प्यार वो सीखे CPR.
Well, thank you, Dr. Jain, for your insights, your work, your unmatched commitment to saving lives, not just in hospitals, but in homes, schools, and communities across India. Your journey proves that health is not just about treatment, it's about prevention, so much about awareness and empowerment as well. It's all in this special segment of Health 360. Until next time, stay informed, stay prepared, and stay healthy.